Hello and welcome to Physio Classroom. This is our second video on cervical palpation technique, and today we are going to practically demonstrate the palpating technique to accurately locate and identify the C5, C6 and C7 spinous processes. And also I am going to tell you how you can precisely differentiate C5 from C6 spinous process, C6 from C7 spinous process, and finally the cervicothoracic junction palpation, that is to differentiate C7 from T1 spinous process. In our previous video of cervical spine palpation, we have already demonstrated the best way to identify the C2 spinous process. Now the next important landmark to palpate in the cervical spine is the C7 spinous process. Once the therapist is able to accurately determine the position of the C7 spinous process, it becomes easier to relate the other structures of the cervical spine from an inferior position. Now, this presumption that C7 spinous process palpation can be done very easily by identifying the longest and most prominent spinous process can often be misleading, as it is quite possible that T1 spinous process can be the longest of the two. So how to become sure that we are palpating the right spinous process? Let's understand this through practical demonstration.
The therapist first marks the most prominent spinous process felt posteriorly over the middle of the lower cervical spine. After that, the therapist palpates and marks one spinous process felt superiorly and inferiorly to the most prominent spinous process. The therapist now positions himself next to the patient and gains control over the patient's head with anterior hand. The two palpating fingers of the other hand of the therapist are placed paravertebrally to the left of the assumed C7 and T1 spinous process. The therapist now either laterally flexes or rotates the cervical spine to the right side. This end-range cervical rotation or lateral flexion to the right always results in all spinous processes down to the level of T4 to rotate towards the left. Since the thoracic vertebrae are fixed due to rib attachments, the therapist should feel more movement at the C7 level as compared to more slowly reacting T1 spinous process. Once the therapist has accurately determined the location of the C7 spinous process, it becomes easier to palpate the spinous process of C6, C5 and so forth. The location of C5 and C6 spinous processes can be confirmed using the cervical extension movement. The index finger and the middle finger pad remains on the assumed location of the C5 and C6 spinous process respectively while moving the cervical spine into extension. The therapist's palpating fingers should now be able to feel the anterior shifting of the C5 and C6 cervical spine during the cervical extension movement. The therapist's index finger pad feels the C5 spinous process disappearing anteriorly when the cervical extension is minimal. It is only at the end range of cervical extension that the spinous process of C6 moves anteriorly underneath the middle finger pad. This method can be used to precisely determine the position of the C6 and C5 spinous process. The C7 spinous process palpation can again be reconfirmed during the cervical extension movement. The therapist can easily feel that the C7 spinous process remains more immobile during cervical extension in comparison to the spinous process of C5 and C6.
So this was all about the palpatory procedure to precisely locate and identify the C5, C6, C7 and T1 spinous process. I hope you liked this video on the palpatory procedure of the cervical spine. In our next video, we are going to tell about the palpatory technique to precisely locate and identify the cervical facet joints. Till then, keep learning, keep sharing and stay connected.